morning and greetings from many hospitals. And I am Dr. Krishna Prasad, the Senior Consultant Urologist and working at NU Hospitals. I've been associated with NU Hospitals for a decade now, and today I would like to talk about laparoscopic surgery or keyhole surgeries. This is an extremely common procedure, and my training has spanned not only India but also at various places abroad at both the US and at the United Kingdom, and where I was exposed to various kinds of techniques in laparoscopy, and with particular reference to its application in urology. We all are aware of what keyhole surgeries are, but their application in urology has literally turned the way we treat and approach patients with diseases with reference to urology. Many years ago, when keyhole surgeries were introduced, they were initially introduced for performing the removal of the appendix or the removal of the gallbladder stones. And a lot of these did not require any special incisions. It was always going through the muscle area, and therefore the pain would not be significant, even if open surgeries were to be done. But in urology, where majority of our surgeries are on the kidney or were in the lower part of the abdomen, what we call as the pelvis, it involved very large incisions, or it involved removal of a part of the rib to approach the kidneys, either the right or the left. And this is what caused a lot of pain to patients in the post-operative period. Keyhole surgeries in urology have completely altered this, and we no longer have to remove parts of the rib or make extremely large incisions in the lower part of the abdomen to approach the common organs that urologists like us deal with, which means the kidney, the bladder, the prostate. If you look at the range of services which are available as keyhole surgeries directed towards urology, we are able to perform surgeries on the kidney, on the ureters, which is the tube which joins the kidney and the bladder, on the bladder itself, and on the prostate. If you look at the two age groups, particularly the pediatrics or the little children, the ability to offer keyhole surgeries in children again gives us the opportunity to sometimes even discharge these children on the same day of surgery, as long as the patients and the parents are confident that they're able to take care of their child at home. We are capable of discharging the patients on the very same day, and thereby making the child extremely comfortable with a stay in the hospital, which is only a matter of few hours. Of course, this is restricted to certain kinds of surgeries in urology, but it is possible, and thereby the children are less anxious or less fearful about the procedures which are there in the surgical realm. If you look at the kind of surgeries which are offered to children in pediatrics, the commonest surgery, I would say, is the block which develops in the pipe which joins the kidney and the bladder, and this is called a pyeloplasty surgery. For many years this was done using the open technique. We can offer it now using the keyhole surgical technique, and the child is ready for discharge within 2 or 3 days. The child is completely pain-free, and since the surgery itself does not involve any large cuts, parents themselves are extremely confident of managing these children, if possible, even in their own homes on the first day, as long as they can take care of a few tubes. If you look at adults, the range of surgeries I have discussed include surgeries of the kidney, bladder, and prostate. But here I would like to point out to you the cancers, particularly of the kidney. Many years ago, the only solution was to remove the entire kidney, However, with progress of time, and especially with the prevalence of diabetes and hypertension being extremely large in our population, it is necessary for us to conserve as much as kidney as possible in the present day. And we are able to, by laparoscopy, remove only the tumor from the kidney and thereby saving the kidney of the patient. And like I have pointed to you earlier, this surgery would involve large incisions on the sides, cutting of the ribs, and was an extremely painful procedure a couple of years ago. However, with laparoscopy, and especially with advanced laparoscopy, which can be offered at any hospitals, we are able to selectively remove only the tumors from these kidneys and thereby preserving the kidney function of these patients. And this can even be done in patients who are diabetics, who are hypertensive, who have also had earlier bypass surgeries. So we do deal with a whole lot of complicated patients like these, and just having a problem with your heart does not mean to say that a laparoscopic surgery cannot be performed for you. Having told you the range of laparoscopic surgeries which are available at any hospitals, I would also like to stress that just surgery alone is not the end all of specialty treatment of cancers. We deal with post-op follow-up, we deal with chemotherapy, where medicines can be given for the cancers of the kidney, or the cancers of the prostate, or cancers of bladder, and all this can be done under one roof at any hospitals, so that the patient feels more comfortable and is in constant touch with a single doctor as a single point of contact. And this therefore enhances the quality of keyhole surgery and the overall quality of keyhole surgery, so that the patient believes, or you believe, that all services are provided under one roof by a single hospital. Thank you.